Welcome, everybody, to another day of the Interstitial Cystitis Association Walk for an IC Cure, Walk for IC Awareness. This is part of our expert interview series where we are giving expert advice and talking about topics that are important to people with interstitial cystitis. I'm super excited to introduce to you guys today Dr. Jessica Drummond. You guys are going to get so much out of this talk. It's going to be amazing. Dr. Jessica Drummond is the CEO of the Integrative Women's Health Institute and author of a book called Outsmart Endometriosis. She holds licenses in pelvic physical therapy, clinical nutrition, and is a board certified health coach. She has over 20 years of experience working with women with chronic pelvic pain, facilitates educational programs for women's health professionals in more than 60 countries globally, and leads virtual wellness programs for people with endometriosis. Dr. Drummond lives and works with her husband and daughters between Houston, Texas, and Fairfield, Connecticut. Dr. Jessica Drummond, thank you so much for joining us today.
Thanks so much for having me. It's my pleasure to be here.
Great. So we've got a lot to dive into in terms of, interstitial cystitis. I think I want to start with food, right? And I think that the IC diet is something that gets thrown around quite liberally in a lot of the Facebook chats and books, even with a lot of physicians, actually. That will be the first thing that somebody hands somebody is just a sheet of basically a bunch of foods to not eat as part of this, IC diet. So one of my first questions to you is, what are your sort of thoughts about that? What is your experience with the IC diet, and how can we build a culture around IC that doesn't have to fear food?
So such great questions. I think it's important to take a step back for a moment and recognize where the IC diet came from. The intentions of the study that kind of created the IC diet was to figure out, there was on observation clinically that people were having worse bladder symptoms when they would eat certain foods. So a survey was basically done, just sort of looking at, people who have bladder pain, if they eat certain foods, do they know that it makes their bladder pain worse? And there was some pretty standard answers, very commonly things like caffeine or citrus or, things like lemon, vinegar, chocolate, rose bubble to the top alcohol. And so that sort of is the only sort of research foundation of what the IC diet is. And it's not to say that that's not helpful. I mean, people do know sometimes what is bothering their bladder, and taking away those super obvious foods so you're not continuing to trigger irritating symptoms can be useful. But if we really want to think about taking a clinical nutrition and lifestyle medicine approach, including physical therapy, to reduce long-term bladder symptoms, there is unfortunately not a one-size-fits-all diet, because there are a lot of things that are variable from person to person, and even in the same person at different times, that can irritate the bladder. And unfortunately, there's no one test, like there's not one food sensitivity test or one, journaling is imperfect, but elimination diet kind of protocol is potentially useful. But so what we have to do is really think very critically, personally, individually, about how to optimize all the different systems of the body that can contribute to bladder pain being one symptom. And in my practice and in our institute, we're constantly saying, don't chase symptoms, optimize systems. And with bladder pain, there's this idea that the way we look at health in conventional medicine is like, oh, your bladder is like somehow broken, we need to fix it. Mm-hmm. But that's not exactly what's actually happening. There are immune factors, there are digestive factors, there are hormone factors, And so instead we have to think critically about all of those different factors and work on optimizing them individually. And it's not as complicated as it sounds. We can talk about that and a little bit more about what that means. But I think to kind of just let go of the IC diet would probably be helpful.
Yeah. Yeah, I 100% agree. And, I even go so far as to say there's no such thing as the IC diet, right? But again, I do feel like I completely agree with you that there is some level of simplicity for simplicity's sake. Like, we get it, right? There are some things like you just mentioned that are, sort of ubiquitously probably irritative to the systems. But the real question is why, and why in that system for you as the patient does that, is that manifesting in bladder urinary urgency, frequency, and or pelvic pain? And I think that's sort of when we're kind of getting into the root cause of some of those things. That's where somebody can really help to guide you. Now, the real question is like, who do you think is best in this situation to guide that person through and navigate some of those waters? Because I feel like it's sometimes where Western medicine falls a little bit short, frankly, in that realm. So can you give me some thoughts about that, and who do you tend to gravitate towards when recommending who to work with in that?
Well, we have a digital clinic, and we've been running it for about 10 years. So having what I've discovered over iterating this program for about a decade is that working with a functional nutritionist, so that's a licensed or certified well, there's not really such thing as a certified, but a licensed clinical nutritionist or naturopathic physician, a lot of the training can be very similar. It depends. That the training in nutrition in general is a little bit all over the place. So it's a little tricky. Yeah. Like, there's not one website. But someone who has a clinical nutrition and or naturopathic medicine approach, and the underpinnings of their training is in what's called functional medicine. So functional medicine is just a perspective. It's not a subspecialty. So a physical therapist could have a functional medicine perspective. It's simply that idea of taking a biologic systems approach and trying to get to the root cause versus masking symptoms. So in our clinic, we have a 4-month program where people, I meet with them first for half an hour and just kind of listen to the story, see if we can really help. Then we do some lab tests. So here's where the systems approach comes in. Mm-hmm. We want to check. So I used to always start with digestion, because, the whole Hippocrates, everything starts in the gut. Yeah. Right. And that's true. But after doing this for 10 years, I slightly disagree with Hippocrates. I think that, yes, he's not wrong, but especially today. So most of our clients are women, just because I work at the Integrative Women's Health Institute. Mm-hmm. Imagine what most women are doing literally today. Like, next week, my kids start homeschool maybe, or they might go to school. My husband's in grad school. His job market's kind of crashed. I run a company of 14 people. Like, every woman right now is like, yeah, it's crazy, right?
Right. A little frazzled.
So the underpinning of digestion is the nervous system. Mm. And so while we usually work in our clinic on digestive and nervous system together, you can't power digestion without down training the nervous system, because you cannot eat in a nourishing way if you're under chronic stress, because it's literally the opposite, right? Fight or flight, rest and digest, mm-hmm. Right? So we can currently work with nervous system and digestive system. And the way we start with 2 labs. One looks at the microbiome, which is the bacterial environment in the colon, to kind of give us our poop bacterial balance. And you're thinking, well, what does that have to do with the bladder? Digestion is important for so many reasons. The first is our nutrients being absorbed, because you can't really heal the bladder. If you think about the lining around the bladder being irritated, that's, you know, essentially a mucous membrane. There's soft tissue. You need protein to heal that. You need mucus and cofactors of mucus, which not are just amino acids and proteins, but also vitamin C, lots of nutrients like zinc and magnesium and things like that. So you need the raw material to heal the bladder, which comes from, hey, can you absorb these nutrients that you're eating? So even if you ate the perfect diet, whatever that is, if your digestive system is not functioning and you're not absorbing nutrients, you don't have the raw materials of healing. And so the bacteria in your colon are a piece of the puzzle to getting everything moving well and excreting well, because you also have to be able to metabolize things and get rid of it. Otherwise it kind of builds up. So constipation is a problem, and constipation, just because of the anatomy, can directly irritate the bladder and cause straining and things like that, and urgency. So we look at the gut microbiome, and then we also look at a lab test called urinary organic acids, which gives us information about what nutrients are being absorbed and what aren't. Sometimes they're low, but that's just because people aren't eating enough of them. But most of the time it's because their digestion is so irritated that they have trouble absorbing. And so again, and it also looks at, so a lot of people don't know this, but the building blocks of the brain neurotransmitters, things like serotonin, which help with sleep and calm pain signaling, GABA, which also kind of quiets anxiety and pain signaling, and GABA, if you have low GABA, you have the anxiety that's kind of like a physical tension. So, you know, that could manifest in pelvic floor tension, the muscles that kind of support the bladder and can be fired up in IC, which I'm sure you'll be talking about at some point. So low GABA, low serotonin, poor sleep, those neurotransmitters are built with amino acids, which are the building blocks of protein. Most women don't eat enough protein, and when they do, it's not well absorbed because of the digestive issues. So those are the two lab tests we usually look at. Sometimes we'll look at hormones, and especially if someone's more perimenopausal or postpartum, or if it triggered around like a cyclical situation. But again, in my experience, sort of like how the gut's not the only thing, we have to look at the nervous system. Usually if we optimize the nervous system and the digestive system, the hormones sort of balance themselves, because you finally have fat in your body, you know?
Right.
You have the raw materials to build hormones. So we look at digestive function first and concurrently with food. So what's the right diet? Well, let's first focus on the system. Is someone calm enough? Are they chewing well? Do they have good acid in their stomach so they can actually break down protein and absorb it? Do they have good digestive enzymes to break down fats and carbohydrates and absorb them? Is there irritation anywhere along the way? IBS, inflammation, leaky gut, low motility, things like that, which sometimes are influenced by those other factors that people also present with, like endometriosis or even pregnancy or something like that. And then, is there a nice daily bowel movement of good quality? So that's really important. That process is much more important than being really specific about which foods to eat, but improving the quality of the diet helps that process too. So I like to focus more on what to eat than what to take out. But there are some factors, you know, we'll see on urinary organic acids test, some people have yeast overgrowth, so we have to be really mindful of sugar and even fruit in that case. Some people have oxalate sensitivity, so we have to reduce the oxalates. I'm almost never for like a no oxalate diet, because oxalates, you know, in the IC diet is like in a lot of healthy foods.
For sure, yeah.
But less, and then once we get the stomach acid and digestive enzymes improved in chewing, your body should be able to digest oxalates. why can some people eat spinach and some people can't? We've got to fix that, right?
Right.
But in the short term, we might give it a rest and lower the oxalates. And then histamine sensitivity is another key thing, which goes back to the bacteria in the gut. There are certain bacteria that actually can help us break down histamine. There are certain enzymes that can help us break down histamine. There are antihistamine foods that we can add. So those are probably the three biggest factors. One other thing would be if someone has an autoimmune picture. So other autoimmune issues like celiac or gluten sensitivity, or comorbid with Hashimoto's thyroiditis or endometriosis, or it's triggered postpartum. That's often an autoimmune picture. So in that case, we move more in the direction of an autoimmune paleo approach. But again, none of these is like the diet. We have to personalize it because most people don't just have one thing.
Of course, yeah. And, I think it's interesting when you pick some of those, key factors to look at in terms of food. What you didn't say is focusing on acidic foods. So can you speak a little bit to, acid in doesn't necessarily equal acid out. And how did we get to, fearing acidic foods in this process?
Yeah, that's a really interesting question. So the idea of like, don't drink coffee, don't eat tons of lemons, probably just came originally from the IC diet survey, right? People thought, hey, this is bothering me, which it probably was for
right. And for us, sometimes other reasons, right? Yeah.
Yeah. And most people in the world today who are under any kind of stress, but especially if they've had chronic pain for a while, are going to have low stomach acid. It takes a lot of physiologic energy, otherwise known as ATP, to make adequate stomach acid, especially if you're eating a diet that's high in beans, whole grains, or meat, because you need to really break down those foods. It's, you got to chew them really well. The ideal number of times to chew a bite of food is actually 40.
That's crazy, because now this is a good point, right? I mean, I feel like you've said this multiple times now, digestion starts with chewing and in your mouth. And I want everybody that is watching this video to, the next time you eat at every meal, I want you to actually see, regardless of what you're trying to do, how many times do you actually eat? When I started to do this, it was under 10. Yeah. And now I'm at like 25 to 30. I'm still not at 40, but I feel like this is a good like little self-check too that we can have people do.
Yeah, and like just move in that direction. Yeah. To be fair, the research done where 40 was the key number was actually in almonds, which is a pretty hard food. But if you're getting to at least 25 is usually my clinical goal for people. But so if you think about that, you've got to actually chew your food, because otherwise you're literally putting like whole beans, whole chunks of steak, like in your stomach. The chemical digestion isn't designed to break that down. It's really not. So it keeps moving, and then it irritates the lining of the small intestine, and it slows down motility, and it flares up the immune system, because the immune system's like, what the heck is this? Like, I'm supposed to be seeing amino acids, not like chunks of steak. Yeah.
Totally.
So if you start to visualize that, which I know can get a little bit gross, but it's important to be like, hey, this system is supposed to work in a certain way. And so actually what people fear is high acid. So things like, we've been trained to kind of go on acid reducers and, lower the acid, but really in the stomach, we want acid. If your body is not tolerating that, if everything's feeling too acidic, it's probably because there's a functional problem. Like it's, you're not chewing your food well, or you're eating way too much protein, which is actually kind of hard to do. I don't usually see that. Or you're just not eating enough micronutrients that help the process go. So not enough fruits and vegetables, not hydrating enough, or sometimes even diluting your digestive juices by hydrating too much during a meal. So it's a little counterintuitive, but if you're stomach acid is too low, sometimes actually that can actually cause heartburn. And then if we think about like the bladder, why is this specifically irritating the bladder? And really, I think it's just that whole idea of your digestive function is not doing what it's supposed to do. So instead of these foods, like, it's not like it's a direct acidity to the bladder. It's more like it's increasing inflammation generally. And you actually probably are having lower pH, in the urogenital microbiome, which will then leave you with less protection from the quote unquote bad bacteria or bad microbes that can irritate the lining of the urogenital system. So it starts in the gut, but it's also about the urogenital system. Do you have good vulvovaginal, urogenital microbiome? And we have to nourish those kind of good bacteria by having plenty of things available for them to eat. So most people just aren't eating enough vegetables. And you might start with cooked vegetables, not like huge salads, because if your, digestion's off, that's going to make it worse at first. But, blended soups are great. Sometimes smoothies, although that can be a little high oxalate, so we have to be careful. I usually start with soup, steamed vegetables, add some zucchini to your eggs in the morning, add some greens, but cook them. And most people, so again, we want to be chewing 40 times, and it's ideal to eat between 8 and 10 servings of vegetables a day, which is hard to get in. So, people in IC are always thinking like restrict. No, I'm like, you're just not eating enough of the actual nourishment that you need.
Yes. Love that message. I mean, I think, and then the fear around, oh gosh, am I going to be able to eat that? What's going to happen if I eat that thing ends up becoming a nervous system upregulation problem. And now you are connecting then that fear response with eating. And then we're just in this poor cycle, which to your point is just furthering restricting those building blocks that you need for true systemic healing then.
Yeah. And so I think it's really important. I actually don't think it's a good idea to sort of track the foods that are bothering you. I think because you can really create these sort of false associations in your brain that, yes, there are certain things that just aren't food. Like, sure, stop eating sugar. That's just not really food. There's no nourishment in that.
Right.
Alcohol is not food. Coca-Cola, a soda is not food. Mm-hmm. Candy is not food. But if it's food, even if it bothers you in the short term, which I just don't want you to be too obsessed about, because you're already irritated, right? When the body is irritated, it's going to take some time for this to shake out. What we want to be really focusing on is increasing the nourishment and increasing the function. While initially it might feel a little more bloated or a little more diarrhea or a little more constipation or some fluctuation there, the less obsessive we get about that. Now, if we keep moving in the wrong direction for, weeks, then we want to check in on that.
Hang on.
But, the sort of day-to-day, like, I'm a little more bloated, I'm a little more flared up, I'm a little more constipated, I'm a little less constipated, I'm a little, that's normal part of this process for kind of getting the digestive system optimized. Lots and lots of mindfulness, like hourly mindfulness, mindful eating. We actually use a lot of, we just started in our 4-month program, started incorporating Hrv tracking, which is heart rate variability. It's it's an objective measure of stress. We use a certain different trackers. I'm always wearing a million of them because I'm testing a bunch of them right now. They're, it's all useful. And a lot of times when someone's had a chronic irritating condition, everything seems to bother you. Like, there's a lot of fear around it. But then we start looking at the stress levels and we're like, let's get really focused on recovery. what's your sleep strategy? You know, let's separate ourselves from blue light devices and news. Sometimes it takes 3 days of that kind of disconnect to get the heart rate variability back to a healthier range. Sometimes it takes a week. Sometimes it takes a week immersion in nature. But it usually shifts, and that's really where I want you to think. Don't start charting like, I ate a blueberry and then I had a flare up, and because that's probably not the truth. Probably what happened was concurrent with having a blueberry, you also got stressed out about something that you might not have even really noticed, had any awareness of.
Yeah, I mean, I cannot stress that enough, how important. I want people to like rewind that segment that you just talked about, because I think we're so conditioned, and we see this in the clinic all the time with our patients with interstitial cystitis. They come in, there's a huge list of things they can't eat, and then I love that you said they're making false correlations or faulty correlations between these two things. And then we don't really have the data to support that this, in your instance, a blueberry or whatever is the reason, because there's so many other factors that can go into that spike in symptoms. So I really want people to like listen to that again, because that we cannot say that enough, right? And I love that you talk about focusing on that, the system approach, and starting basically, right, whenever we find that we have a problem, it's like, well, what are the steps before that then? Right? So if we're having an issue there, then what are the steps before that? So love that. I want to move to something that you touched on in terms of a couple little segments back. You talked about small intestine, and that your small intestine needs to, be getting introduced food that is, digested with the good stomach acid and stuff like that. Sometimes things that come to mind when we talk about the small intestine is, number one, probiotics, and number two, SIBO. So can you speak a little bit to some of the, any correlation that you've seen with SIBO? What is it? And does it have any correlation with urinary urgency, frequency, and pelvic pain?
Yeah, so SIBO is an acronym for small intestine bacterial overgrowth. You can also just think of it as small intestine microbial overgrowth, because sometimes it's not just bacteria, sometimes it's also fungi and viruses and other little bugs.
Okay.
So usually the presenting symptom of that is bloating, and pretty chronic, irritating bloating, kind of constant bloating. Although some people will like wake up in the morning with a flat stomach and be like, I don't know what happens. And then as soon as I drink water, it's like puffy. So bloating is the key issue, because literally what's happening there, you should not have a huge community of bacteria in your small intestine. You should have a small community of bacteria in your small intestine that's just sort of supporting the lining of the small intestine. The huge community of bacteria should be in your colon, your large intestine.
Got it.
So what we always think about with SIBO is like, how do we kill it off, right? So there's the sort of antibiotic or antimicrobial herbs approach, kill it. But that's, again, a little bit oversimplified. And it usually doesn't work, at least not for long. Like, you can take the antibiotics, it'll be gone for 3 months or something, and then it comes back. I'm like, ugh. And there's about a 47% correlation. So if someone has SIBO or symptoms of SIBO, like bloating, and then you can actually breath test and see if they actually have SIBO. I don't even bother anymore, because 98% of my patients with bloating and pelvic pain have SIBO.
That. Yeah.
They just have it. So we don't even bother to test. But let's assume that you test positive for SIBO. There's a couple different kinds of SIBO, but again, it's a little bit irrelevant. If you just relieve the SIBO, if you just get the digestive system functioning more optimally again, without even thinking about, without even doing anything really specific to the bladder pain will relieve in almost half the cases.
Wow.
Yeah.
It's kind of amazing.
So again, that's why we focus on digestion, right? So small intestine, so you have to think about, how are we suddenly getting all these microbes in the small intestine that don't belong there. It's a closed system, right?
Right.
Well, it has to come from one of two places: your mouth. So none of the food that we eat is sterile, and that's totally fine because we have stomach acid.
Mm-hmm.
But remember, I just said most people with chronic conditions have low stomach acid. So we can do stomach acid supports supplementally with things like betaine HCl. Even for, some people who have enough ATP but aren't generating enough stomach acid, you can use something as gentle as like diluted apple cider vinegar. Most of my patients have had chronic pain and fatigue for a long time, so we usually use supplements. And just again, don't abuse your stomach acid, right? Chew your food and calm your nervous system.
Right.
So we have to kill off the microbes at the stomach. And so for people that have IC and maybe have had some other thing like endometriosis or colon issues, surgical, so there's a little doorway. So one way is for the bacteria to come in from the top. The other way is for them to kind of slide back from the bottom. There's a little doorway called the Ileocecal Valve between the small and large intestine. That should be a one-way door from the small to large intestine and then close. But for people who have maybe endometriosis or adhesions or had a bowel surgery or something like that, that doorway can either be sticky or there could be adhesions around it. It can be stuck open. It cannot close efficiently. And sometimes people have had that part of their bowel actually removed. So we're always going to kind of be managing SIBO. And then the other issue is that there should be a good pace of motility. Things should move through the small intestine at a consistent pace. And again, if there's endometriosis growing on or around the small intestine, there can be little pockets where bacteria and other microbes can thrive. Think about it. There's a lot of food in the small intestine. It's warm. And so if there's not good motility, it's a great place for bacteria to thrive. So slow motility we work on with specific supplements like artichoke and ginger and things like that. And we really like to work with pelvic physical therapy with this to do more visceral abdominal mobilization for both the small intestine and kind of that whole region, but also if somebody does have a ileocecal valve that hasn't been removed, try to get the motility better in that area so that the valve works better.
Yeah, that's amazing. And a good thing to remember that there's another subset of pelvic physical therapy that is specifically trained on working on those areas, right? So that is different than, the kind of the traditional pelvic floor physical therapy where we're feeling all the muscles, which is obviously important as well. But there is like a subset of physical therapists that are also specially trained in something called visceral mobilization, specifically for colon motility, ileocecal valve, and all kinds of other abdominal contents, we'll say, of all the organs in there. So that's really interesting. And so what then? So how quickly then obviously then I feel like how quickly should somebody be like, do you feel like someone can work on their digestion by themselves, or do you really feel like this needs to be, a coaching situation, or when do you feel like there should be somebody inserting really to help somebody through these issues?
It's complicated. I think in the most cases, people will benefit from working. So our program is an initial assessment with a nutritionist. And then we have 16 weeks total, but about 12 visits of health coaching, because it's one thing for someone to be like, okay, here's all the million things you need to do, meditate twice a day and take your supplements and add more vegetables. And you're like, I'm exhausted. I don't even know how to cook. Like, what do you want me to do? Right. So there's a lot of lifestyle shift that has to happen. People have to create space for this healing in their lives. They have to change what they're eating. They might have to change their bedtime, their work habits, some social things. The great thing about right this moment is that almost everyone's mostly eating at home. So that helps, kind of with the cooking shift. But even if you have food delivered, you have to know that. So coaching is the support that helps you make this lifestyle behavior change over time. And that's a big part of the work that we do, really every week, kind of checking in. How's my stress? Am I moving in the right direction with my heart rate variability? How's my digestion? Are we making progress there? What can we continue to do? So coaching is a huge piece of it because, you know, hey, look, I mean, you can learn kind of what a basically healthy diet is from anywhere.
Right.
And while it's, you know, while it's not that simple, most of us know, like, hey, if I have a choice between like eating sauteed vegetables and fish or like this bag of Oreos, like we know the difference, right?
Right. Sometimes we don't have the self-control, but
right. But we don't always choose that for so many reasons. And sometimes it is fairly complicated. So you want to have, you know, your questions answered. You want to know options, like what can I eat if my whole family will only eat pasta? You know, what's my option? How do we work through that? So that's what our coaches do with our team. And at the beginning, we want the food plan to be limiting, you know, lowering some of those things that are the things that chronically irritate people. Like in my book, for example, all of the salad dressings have no vinegar, no citrus, just so that we start with less symptoms. It's more motivating the faster you feel a little bit better.
100%. Have a question about, you know, you touched on this briefly before about how a lot of people just feel this overwhelming fatigue, right, with everything, and everything seems extremely daunting, and that even one change seems exhausting. I know you speak a lot about the thyroid, adrenal, hormone axis. I know that that's a much bigger conversation than the few more minutes that we have, but could you simplify that connection between our cortisol system, our thyroid system, and how that might play out in a chronic pain condition like interstitial cystitis?
Yeah, and I think the simplest thing to say here is that the brain is where it all starts for those axes. So if there's chronic inflammation, whether it's from a bacterial overgrowth in the urogenital system around the bladder, whether it's from a gut microbiome imbalance, whether it's from constipation, whether it's from big chunks of steak irritating the lining of your small intestine, whether it's from stress or eating too much sugar, or drinking too much alcohol, or whatever, no matter what it is that causes general inflammation, that inflammation will also impact the brain, and there'll be general inflammation there. And all of these hormone axes, whether it's stress buffering, adrenals, or thyroid, which is metabolism generally, or your reproductive hormones, everything starts in the brain. And when the brain is inflamed, so inflammation is one key problem, blood sugar instability is another key problem, and low nutrients, especially low iron, that can happen, especially in a female population with, like, a lot of times, again, you've got IC with other things that might cause heavy period bleeding. That's the number one cause of anemia in the Western world. So if the brain is not fed and it's irritated by inflammation, no matter what the cause, and no matter whether you're not absorbing or not eating well, then all of those hormone axes will be affected. The good news is, fix that, and you don't need to kind of go as far upstream about like patching together hormones, if that makes sense.
Yeah, totally. Right. Get that foundation a little bit better and fed better, then that can almost be like a trickle down effect of improvement in that inflammatory process. It's great. Excellent advice. You know, lastly, you know, you wrote an awesome book called Outsmart Endometriosis. And I love that book because it really focuses on the female that also has really big goals to like stay working and be an active member in their family and in the workplace. And so I know that IC and endometriosis are very commonly concurrent in a lot of people. So why don't you go ahead and give us a little bit of just background on what that book is about and why you wrote it, and then what do you feel would be some important crossover things for someone with interstitial cystitis as well?
Yeah, so I think the nutrition approach that we take in that book is very similar, whether you're talking about endometriosis, IC, vulvodynia, any underlying cause of pelvic pain, because it's the same questions. It's the same digestive function. It's the same oxalates, histamines, autoimmune. So the process that we take people through in that book will be the same. And as you said, there's a lot of overlap. A lot of people with IC will also have vulvar pain. They'll also have endometriosis. They'll also have other underlying causes of pelvic pain. So I think it's a little bit oversimplified to try to take one of those systems out of the body. And then I wrote that book, and I wrote it in that particular way because I've been treating patients with pelvic pain for more than 20 years now, believe it or not. I realize I'm
It's crazy.
I was like, but what I think is so consistent in my clinical experience about people that I've worked with pelvic pain, men and women, although the vast majority of my practice for the last decade has been women, is that these are very driven people by and large who get kind of sidelined. And I think in a way, there's a little bit of that feeds into itself. But when you get sidelined by a chronic pain condition, but you have like a super driven personality, you learn to silence the messages of your own body. And so that's why we take such a nervous system centric approach, because I really cheer for people who want to do stuff in their lives. And I think the vast majority of people do. I don't think a lot of people like being sidelined by anything. But I think that what often happens is either there's sort of a succumbing to that health issue, especially if it's something so chronic, pain, fatigue, where you're just like, there's some level of like giving up, which I completely understand, having been in that sort of experience myself, or there's a silencing where, I've seen people work through really intense pain, which is also just as bad because over time it's unsustainable. So one way or the other, people hit a brick wall. And so the reason why I wrote the book in that way is because whatever people want out of their lives, whether it's some big driven goal or just to be really present with the life and family and relationships that they have, it doesn't have to be something, phenomenal or, whatever we would define as amazing. It just has to be present with what they really want. My goal is to help them have that. I feel like that's really the mission. I think you probably share that.
Yeah, 100%. And that's why, when I read your book, I was like, this is such an important message for anybody that's dealing with a chronic pain condition, especially chronic pelvic pain, because I think that sometimes hits even just one more level of just at that fundamental human level where, some of our basic bodily functions are impacted. And so it was a really powerful book for me to read. And I think that your message is I just want to share that a lot, because I think it's so important to really like stand together with people that have been sidelined, but to know that that's not the end of the journey. And so I really appreciate your contribution in that way. I think that you have really focused on areas that are so lacking in our community of pelvic pain patients, and it's really great. And I'm so thankful for you that you gave your time today to do that. Do you have any last parting words other than that amazing one?
I would just say that it's okay if it takes a while too.
Perfect.
I had a lot of health problems at some point, which sort of triggered a lot of this exploration. And we're taught that like, hey, you go to the doctor, they give you the drug, you're fixed. And almost nothing actually really works like that. Like even, maybe you get the Z-Pak for the sinus infection and that goes away briefly, but like the reason for the sinus infection didn't go away. So maybe you have one again in 3 months or 3 years. So the idea that healing something that's been chronically and intensely bothering you for, on average in this population, 8 to 12 years?
Yep. About that, at least.
Something like that. It was about 15 when I started, but I think it's slightly better now.
It's slightly better. We're moving in the right direction.
Still bad. So, a reasonable, supported time for healing, 4 to 24 months is what I usually say to my clients. And I think that's also calming to the nervous system. Like this is not something that we get a drug for, we get a magic wand for, whatever, and it goes away. We rebuild our systems from the inside out, and we have to be a little patient with that.
Yeah. And then I feel like too, just to piggyback, we can sometimes get the symptoms to go away sooner, but the lasting relief and the lasting effects of that's what takes a longer time as well. And I love that you just said, just for it to be okay. And I think that setting expectations that way can sometimes really help the nervous system calm down as well, right? So
yeah, and your team, like who's on your home support team, let them have that kind of expectation too. And this would be for anything. For you, it just happens to be this issue.
Yeah. 100%. Well, Jessica, thank you so much again. Where can people find you, get in touch with you, find your book, all of the things? How do people work with your team?
Yeah, so our institute is integrativewomenshealthinstitute.com, and mostly what we do there is train other professionals. The book, I'm happy to give anyone in your community a free copy of the book. Go to outsmartendo.com.
Awesome.
And through that, you can also learn about our kind of digital clinic, health coaching clinic. And while it's somewhat endocentric, we work with a lot of people with lots of different kinds of pelvic pain. So you're welcome to, through that, get a strategy session to chat with us.
That is so awesome. Well, thank you so much again for your time, your expertise, and your contribution to the IC community. Really appreciate it, Jessica. Thank you so much.
Thank you.